Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
So what is this hypoxia GERD? What do you see in hypoxia GERD? Hypoxia GERD, if you see in the present day and modern anesthesia machines, these hypoxia GERD are present. Here we have basal oxygen flow is present in the anesthesia machine. So what does this mean? What is basal oxygen flow? In any case, okay, if in any case oxygen, some amount of oxygen will always be flowing into it. See, for example, if you open the nitrous oxide valve, even if you open the nitrous oxide valve, always some proportion of oxygen will always be uh, opened. So if you open 3:1 3 times, if you open nitrous oxide, automatically oxygen will also gets opened in a fixed proportion. That is called as hypoxia GERD. So that is the reason why in hypoxia GERD we have nitrous oxide and oxygen. This is actually a rotameter itself, but here once you open the nitrous oxide, even the oxygen be uh, will also be delivered to the patient, okay, in a fixed proportion. That is hypoxia GERD. So this flow of oxygen in the modern anesthesia machine, this is in the downstream, that is to the patient, okay, that is down the pressure gradient. Here downstream means, okay. So this is about the anesthesia machine.
thank you and thank you for watching.